Hello guys, thank you so much for joining us on this episode of our health discussion. May God bless you. On today's episode of our health discussion, we are going to look at ovulation disorder, and this discussion will be to look vividly at what ovulation disorder is and what is actually causing you to have ovulation disorder. So if you are clicking on our videos for the very first time, please don't hesitate to hit the red subscribe button and click notification. May God bless you. Thank you very much. For those who have been here, thank you and continue to be with us. Now, what is actually ovulation disorders? So you first of all understand that ovulation is the release of an egg from the ovaries into the fallopian tube. So every lady is supposed to at least release an egg during a cycle. But now, because for one reason or the other, you might not release this egg, or you might release it maybe once after 4 months or once after maybe 5 months. So if you are such a lady, then you will need to understand this, why it is causing you to release this egg maybe after 4 months or after 5 months. So we are going to explore all of this and to make you understand why you might be releasing your egg maybe after 4 or 5 months, or you don't even release the egg at all. So thank you so much for being here. Like I said, if you're clicking on a video for the very first time, please don't forget to hit that red subscribe button and click notification. May God bless you. Thank you so much. Now, what is ovulation disorder? So ovulation disorder mean that you ovulate infrequently. It therefore means maybe you ovulate after 4 or 5 months, like we said earlier, or you don't ovulate at all. This accounts for 1 in every 4 infertile couples. It therefore means that it's 25%. This is huge. 25% of your fertility, of infertility, is actually based on this ovulation disorders. Problems with regulations of reproductive hormones by the hypothalamus or pituitary gland, or problems in the ovaries can cause ovulation disorders. Now, problem with reproductive hormones by the hypothalamus, you need to understand that hypothalamus is a part of the brain here, and if you have issues with it, then you'll have this ovulation disorders. Now, what is actually causing this ovulation disorder? So we move step by step. The very first point is polycystic ovary syndrome. Polycystic ovary syndrome, yeah, in itself is a major cause of infertility. So polycystic ovary syndrome, or PCOS, that is PCOS, causes a hormone imbalance which affects ovulation. So because it causes this hormone imbalance, it affects your ovulation. PCOS is associated with insulin resistance and obesity, abnormal hair growth on the face or body, and acne is the most common cause of female infertility. So you can see that PCOS is actually the main common cause of female infertility. But now, all of what we have mentioned as maybe symptom signs of PCOS should not carry you away. You should not be, maybe you have hairs on your face and you have acne, you just start saying that, oh, come on, it's because of this. No, please, we understand for you to actually confirm that you have any of these. Maybe you have PCOS, you should consult with your doctor, and your doctor should be the one to confirm for you. But as signs of PCOS is associated with insulin resistance, obesity, abnormal hair growth on the face and body, and also acne. So take note of all of these and also know how you can control it. The next cause of problem with your ovulation is actually hypothalamic dysfunction. So the next actually cause of ovulation disorder is hypothalamic dysfunction. Hypothalamic dysfunction here has to do with the part of the brain, hypothalamus. So two hormones produced by the pituitary gland are responsible for stimulating ovulation each month, and these hormones are what? Follicle-stimulating hormone and luteinizing hormone. So you see that your hypothalamus is responsible for the production of this, and if your hypothalamus has a problem, then obviously you are going to have a problem. Excess physical or emotional stress can also cause this. Okay, a very high or low body weight, or a recent substantial weight gain or weight loss. So for those who are maybe into weight gain or weight loss, please be careful. Don't just do it vigorously so that you may lose a huge amount of weight or you gain a huge amount of weight. So you have to do it gradually. The next cause of hormonal disorders is premature ovarian failure. Premature ovarian failure, also called primary ovarian insufficiency. This disorder is usually caused by an autoimmune response. Therefore means that it's not actually caused by autoimmune response, means your body actually is causing it. And because it is caused by autoimmune response, by premature loss of eggs from your ovary, possibly from genetics or chemotherapy. Chemotherapy here is cancer treatment. So this is not caused by you. That's why I said it is an autoimmune something. So anything that is autoimmune is not caused by you, like maybe an infection. It is just your body responding. And this means that the ovary no longer produces eggs, and it lowers estrogen production in women under the age of 40. This is not cool at all. Now, the next cause of hormonal ovulation disorder is actually too much prolactin. Too much prolactin here is a major issue to some ladies. You see that if you squeeze your breast, what you see come out from it when you are not pregnant nor you're not breastfeeding, you see breast milk coming out from it. This could be as a result of too much prolactin, so it is always good to check. So the pituitary gland may actually cause an excess production of prolactin, that is hyperprolactinemia, which reduces estrogen production and may cause infertility, usually related to a pituitary gland problem. This can also be caused by medications you are taking. So your medications could also be the cause of you having some of these pituitary gland issue. So look at this cervical discharge. Now, this can also help you to know about your ovulation. You see that if you look at this one is just after menstruation. The next one is some days away from menstruation. The next one is almost at ovulation, and the last one, final one, this one is at ovulation. So with this knowledge, you are going to see that if you take care, make sure that you go for your screening early enough, you might be able to discover some of these problems we have actually mentioned here. So thank you so much for joining. May God bless you. Please don't forget to subscribe to our channel. Check your heart and maintain your work, and also recommend your friends to subscribe as well. May God bless you. Do have a wonderful time. Thank you.